For this video, I would like to try something different and teach you how a doctor tries to diagnose a patient. You can think like a doctor. Having a fever is defined as a temperature greater than 37.8 degrees centigrade or 100 degrees Fahrenheit. Here are the basic questions. Number 1, how high and how long is the fever? Number 2, was the patient exposed to anyone with fever or cough in the past 2 weeks? Number 3, is there an outbreak of a disease? Number 4, is there a history of travel? Depending on which country you lived in, there could be diseases more common in that area. Aside from fever, ask the patient for these symptoms. It's not 100% accurate, but it applies to the usual cases. First, let us divide fever into those less than 7 days and those more than 7 days of fever. In the first category of fever less than 7 days, check the following. Number 1, presence of body pains, joint pains, and feeling of tiredness. Consider the flu. Number 2, did the patient lose his sense of taste and smell? Are there many cases of COVID in the area? Consider COVID-19 infection. Number 3, presence of swollen tonsils. Consider acute tonsillopharyngitis. Number 4, presence of urinary symptoms such as difficulty in urination or painful urination. Consider urinary tract infection. Request for a urinalysis. Number 5, presence of diarrhea and low-grade fever. Consider acute gastroenteritis. Number 6, presence of cough, phlegm, fast breathing, and lung crackles. Consider pneumonia or acute bronchitis. The patient needs a chest x-ray. Number 7, presence of any bleeding from the nose, gums, or black-colored stools, especially if this occurs after the fever disappears. Consider dengue fever. Check the complete blood count and platelet of the patient. Number 8, presence of yellowing of the eyes called jaundice and tea-colored urine. Consider liver problems such as viral hepatitis or leptospirosis. For long-standing fever of more than 7 days, here are our differential diagnoses. Number 1, low-grade fever in the afternoon, especially if with exposure to a family member with cough. Consider tuberculosis. Do a chest x-ray. Number 2, severe headache and high-grade fever. Consider typhoid fever or meningitis. Number 3, did the patient travel to a malaria endemic area? Is the patient having fever and chills every 2 to 3 days? Consider malaria. Number 4, presence of heart murmur upon examination by a doctor. Consider heart valve infection, medically called infective endocarditis. Finally, watch out for these danger signals. When a patient shows any of these signs, you need to bring the patient to a hospital quickly. These danger signals are difficulty of breathing, presence of gum bleeding, nose bleeding, black stools, or very pale patient, low blood pressure and weak pulse, very sick-looking patient. For unclear cases of fever, it is always best to consult your doctor. I hope you learned something today about the various causes of fever.